I just wanted to start by saying a really good morning to everybody, and good evening to you, Alison, of course, being the evening there. Yeah, it's great so many people already here. A quick introduction, I'm Sharon Elliott, for anyone that doesn't know me, and I'm the CEO of Ethiopiaid Australia. And this is a real pleasure to welcome you to our first ever live Q&A session. And here with me today, I'm delighted to be able to introduce you to a very remarkable woman. She's an Emmy Award-winning television producer for a film about the journey of a woman with fistula in Ethiopia. She's an innovator, she is a strong advocate for women's empowerment, and she is the co-founder of our maternal health partner, Healing Hands of Joy. So please join me in giving a virtual, but nonetheless very warm welcome to Allison Shigo. Allison, it's amazing to have you here with us this morning. Anna said, of course, your evening, so thank you. I think it's just after 8 p.m. where you are. Thank you for joining us.
Oh, it's so great to be here with you, Sharon, and everyone that's joined. Really appreciate it. And it's such a wonderful opportunity to just share more about Healing Hands of Joy and our work in Ethiopia, and of course our work with Ethiopiaid, and just excited to be here. So thank you.
Thank you. Okay, so at the start of every meeting, there's always that bit of housekeeping. So for everyone listening in, here's how today's webinar is going to work. To start with, it'll be Allison doing all the work. I'm going to put her under the pump with a live interview, which we expect to be for about 30 minutes or so of the session. And then we'll be opening up the floor to any questions from you in the audience for the remaining time. If at any point during the questions, during Allison's answers, you come up with any questions, do feel free to pop them in that little chat box that should be on the bottom of your screen. Those questions will all come through to us, but we'll save them up and go through the questions at the end and answer them then. So you'll be able to see we have an extra person in the room with us to hear. This is Emily Unkovic, who many of you will have spoken to on the phone or maybe via email. She's our wonderful donor relations coordinator. So she's going to be monitoring the chat box and making sure those questions are picked up. And as I said, we'll come back to them at the end, or worst case scenario, if we do run out of time, or if someone comes up with one of those slightly complicated questions, we promise we'll get back to everybody afterwards if there's anything we can't address during today. So said, then just for those few people, I noticed a few people have joined us since we started. So I said, questions at any point, just pop them into that chat box and they will come through to us here. So we'll get going. Said this isn't, we don't want to hear too much of me talking. I think we're here to hear from you, Allison. And of course, I was really delighted when you were brave enough to agree to take part in our first ever webinar. So a very, very brave and very exciting thing for us to do. And I think obviously the people that have joined us here today and ourselves are here because we all feel very strongly about the plight of women who are living with fistula. Sadly, it is undeniable that fistula is still a large problem in Ethiopia today. And a big reason behind that is because maternal health is still a fledgling concept. In fact, it wasn't actually until the 60s that fistula repair surgery was even available to women, which is why the work that you and Healing Hands of Joy are doing is so invaluable. But if we can backtrack sort of 10, 11 years ago, can you just talk us through how you founded Healing Hands of Joy?
Absolutely. So I actually first went to Ethiopia in 2005, working on a Walk to Beautiful. And a few years prior, I didn't even know what obstetric fistula was. And I had never been to Ethiopia. I was living in New York, City, working at a documentary production company. And we read an article in the New York Times about the Addis Ababa Fistula Hospital, which you said was, founded in the 60s by Dr. Catherine and Reginald Hamlin. And we were just blown away as filmmakers. We had never heard about obstetric fistula. We had no idea that millions of women were suffering. And so we really felt compelled to do something, to share their story with people that didn't know in developing countries and had never heard of it like us. So first, went with our crew to film, and I was with the crew that worked actually in the countryside. So I was able to really see firsthand women that had been suffering for years and had no idea also what they were suffering from. They were shunned by their communities. They were so excited that someone was there that wanted to hear their story because they had been really voiceless for so long. And their families had, really despised them. And so just to see that joy in bringing them to the fistula hospital, which at the time the only one was in Addis, so it was several days journey for these women. And then also we filmed at the hospital, so we met women that were going through surgery and met women that had also been cut off from their families and some that were not fully cured. And so just seeing this gap in helping women to be able to know what fistula was, know that there was treatment, know that it could have been prevented, and also to help them if they didn't have anywhere to go after surgery, just stayed with me even long after we filmed. And then several years afterwards, after getting the film out, it just, those women's stories never left me. And I kind of asked myself, well, what could I do, to help? But I knew that there was still missing pieces in the work in Ethiopia. So my aha moment was 2008. I read an article in National Geographic that was called Necessary Angels. And it was actually about a program in India that was helping women that had leprosy to become village health workers. So providing education and training and tools. And women with fistula, as you know, are like modern day lepers. I mean, they're often treated, as outcasts. But this program helped these women with leprosy actually raise their social status, help them to be able to raise infant mortality rates and maternal mortality rates because they were educating communities in India. And so that was sort of, I said, that's what we can do. We could actually work with women with fistula to empower them and equip them to help them to become advocates in their communities. And so set to work then figuring out, how to get started. Because of A Walk to Beautiful, I had a lot of great contacts with the Hamlin Fistula Hospital and also the Ethiopian ambassador to the US, who connected me with some really key contacts in Ethiopia, the Minister of Health and the head of Clinton Health Access and others that helped us decide about a location for our pilot up in northern Ethiopia. And then there met with regional health bureau heads and both government and non-governmental organizations to help us pilot the Safe Motherhood Ambassador program. So that's kind of the launch of it in 2010, and then we opened up our first rehabilitation center and trained first 6 Safe Motherhood Ambassadors, one of which ended up speaking at the United Nations a few years later for the International Day to End Obstetric Fistula. So.
It is amazing, and look, I think it's a very exciting model. As you say, there was nothing like the Safe Motherhood Ambassadors out in Ethiopia, and so when you'd seen that model in India, but as you say, there was only the one fistula hospital in Addis at the time. What made you decide that the Safe Motherhood Ambassadors were the way to go, as opposed to maybe investing in another fistula hospital or training more surgeons? What was it particularly that struck you about that model that made you go, this is for us?
Well, it was two things. I mean, one, Ethiopia has been blessed with a pretty extensive network of treatment centers. So even compared to other, sub-Saharan countries in Africa, because of the Hamlin's work early on, they had a hospital that had been established. And then in 2006, actually, they expanded. So they opened up 4 satellite hospitals, being able to reach other regions. And then also there were, public hospitals. So I really felt like the treatment piece was there in Ethiopia, that we didn't need to open up new hospitals. We didn't need to train more surgeons. We really needed to prevent the issue from happening in the first place. And I think that, when we know that in the US and Australia, fistula has been eradicated, we know that it's possible in a place like Ethiopia. So instead of continually, treating new patients, let's stop, women from developing fistula. So prevention was really key, and education, on the ground to prevent fistula. And then also it was just the women themselves. I mean, really, meeting women that had suffered from fistula. One of the characters in A Walk to Beautiful, Wubete, when we met her at the hospital, she was 17 and had been married 4 times, by the age of 17, was abused by her father, was abandoned by her husband. Her mother had died and she wasn't fully cured, and she just had nowhere to go. And she was going to be begging on the streets of Addis without any support. And so that was just a huge gap in patient care, that even though, women had been maybe treated physically and in some cases not even completely healed, there was not any programs to really heal women, like mind, body, and spirit, really being able to help holistically, to help them through the trauma, of living with fistula for many years and being abandoned by their communities and being divorced and, stigmatized. So that's where our curriculum was multifaceted, in that, it was counseling, psychological, psychosocial, spiritual. There was economic support and education, being able to provide microloans to help the women become financially independent. And then, of course, key is maternal health education. So really being able to help women who had suffered from fistula understand why the fistula was caused and that it could have been prevented, and then equip them and give them confidence and skills to be able to educate other pregnant women. One last thing that, what we noticed when we were doing needs assessments when we started was that there were actually repeat cases of fistula. So a woman that had come to the hospital, had, with fistula, had been treated, but then because she didn't receive any education, she would develop fistula again. So there just was, these key critical gaps. And so that's where I felt like the Safe Motherhood Ambassador program really could fill that gap, and just, really help empower the women that the healthcare system had failed to be able to help other women.
Amazing. It really is amazing work. And I think without a doubt the Safe Motherhood Ambassadors are having an incredible impact across all of Ethiopia. And in fact, for those tuning in, but since 2009, Healing Hands of Joy have trained over 1,800 formula fistula patients as Safe Motherhood Ambassadors. I think that's a pretty mind-blowing number. And look, speaking of impact, Alison, because you've been at the front of this change for sort of 11 years now. Obviously, you see that progress within each group of women that you work with, but what kind of progress do you feel you've seen regarding fistula and maternal health in Ethiopia during that time?
Well, I mean, there's been a tremendous amount of progress, and it's, of course, not only Healing Hands of Joy's contributions, it's Ethiopiaid and many other partners, but the government also has really really made a push towards Millennium Development Goals and then Sustainable Development Goals to be able to really decrease that maternal mortality rate, because was quite high in Ethiopia. So as far as just the number of cases of fistula, we've seen a huge decrease from an estimated 100,000 when we filmed A Walk to Beautiful to now there's under 37,000 estimated. So really have seen that the numbers of cases are going down. And that's correlated with the number of institutional deliveries going up. So, one of the main reasons why fistula is caused because women are delivering at home instead of at a health institution. And so by the time they can get to a health institution or get emergency obstetric care, it's too late. Their baby will have died and they might develop a fistula. So in 2010, when we first started, the institutional delivery rates was 10% in Ethiopia, so extremely low. And in 2016, it rose to about 26%, and now it's at 48% nationally. So it's been a huge, huge progress, but obviously still a long way to go in that you still only have, 50% of the population of women giving birth at a health institution. So that's kind of just in terms of, macro. For our work, what we've seen in Tigray, which has been really exciting, where we started. So when we started in Mekelle, opened up our first center, Mekelle is the capital of the region of Tigray, and that was where Ethiopia first came alongside us. And we have just seen such progress. We saw a 44% increase in institutional deliveries in the counties where we were concentrated, did the most work with community engagement and Safe Motherhood ambassadors. And we saw a 75% decrease in fistula prevalence rates. And so we actually made the decision at the end of last year to close our rehabilitation center that we had opened 10 years ago, because there were under 100 cases at the Mekelle Fistula Hospital being treated. So the numbers had just dropped so dramatically that we felt like it was best for us to move to other regions where there was a greater need. So that's been really exciting. And we still are working in Tigray, still helping to support the 650 ambassadors that we have trained in the area. And there are still hidden cases. I mean, there are still, that need to be identified. But we did open up centers in the Amhara region and in the south where there were really high prevalence rates of fistula, and really being able to work in those areas where there's full capacity at the fistula hospitals. And another huge, progress that was made was really engaging the Federal Ministry of Health in a campaign to eliminate fistula. So in 2016, we launched a campaign with partners, and then started a fistula task force so that partners would really be able to meet and see how we could work together and collaborate. And so that was just to have a goal and to have a strategic plan at the Federal Ministry of Health's letter was just incredibly exciting for that momentum to work towards eradication in the country, which has been our vision from the beginning. And one last thing is just we had went back and also did a monitoring exercise of about 400 of our now 1,900 Safe Motherhood ambassadors, and just to really see the progress that they were having on the ground in communities. And we found that for every Safe Motherhood ambassador that was trained, they had educated 96 pregnant women, and overall have educated, our Safe Motherhood ambassadors have educated nearly 40,000 pregnant women in the 3 regions. So we're really seeing the work of the Safe Motherhood ambassadors in concert with regional health bureaus and other partners and midwives to really increase that institutional delivery rates in order to see fistula decrease.
Wow, it's really good to sort of hear that check, because that's huge amounts of change. So while sometimes it feels like, you know, you're just doing these one bits and they're just a little thing, it's just huge. That's amazing. Oh yeah, look, it certainly makes me feel good to hear that. But obviously the fact that these changes are happening, there's a lot of improvements, but there is still a very real and very urgent need right now, of course, as well. And actually earlier in the year, we ran an appeal, which we sent to donors, sharing a case study of an amazing lady called Buna, who is now trained as a Safe Motherhood ambassador. But before that, she'd spent 25 years living alone and in pain due to fistula. And we know all this progress is happening, but we also know that still, particularly in the rural areas, there is still a lot of fistula out there. And suffering for that long, is that still a story that's fairly mainstream, or was Buna's case sort of quite a not unique, but more unusual?
It is more an outlier. I think that, you know, we're seeing also in the progress and in the work that's been done over the last 10 years is, you know, in really raising awareness within communities. So for each ambassador that we train, you know, she's the focal point person in her community. So we're able to work with the community health workers and midwives and religious leaders and various stakeholders to really help continue to raise awareness. So with that and with each ambassador doing that work, we're seeing that now new Safe Motherhood ambassadors that come in for surgery and to come through our program actually have a much shorter duration. So they've lived with fistula for fewer years. In the Amhara region, for example, about 50% of our Safe Motherhood ambassadors live with obstetric fistula for 5 years or less. So that's great. I mean, I think that that's our goal, is that we really want to be able to increase awareness, to be able to reduce that stigma, because the treatment centers are there. So, you know, why would a woman need to suffer for 25, you know, years, 10 years, I mean, 5 years? I mean, just, can you imagine, you know, leaking urine and not being able to, you know, interact with anyone in your family or community? It's just, when there's a fistula treatment center, you know, probably only a few hours away. And that was one thing that, you know, I think when we first started and just meeting women living with fistula that, you know, only lived a few hours from a treatment center and yet had lived for, you know, decades with fistula was just unacceptable. You know, I mean, that is where, you know, education and awareness was so important. And one of our ambassadors that I just was with in March, I wanted to just quickly share her story, Duco, because it just is a great example of how the Safe Motherhood ambassadors, when they're trained, they're so personally motivated to go the extra mile to be able to identify women and help them get treatment, as well as educate pregnant women. But I'll just quickly share a picture of Duco. When I was at our center in the South in Hawassa, got a chance to meet her. She's in the white scarf. And Duco herself lived with fistula for 12 years. So she was not aware of the treatment centers. And she said, sorry, just pulling it up here, but y'all can see, you know, I was so sad in God. My husband was not there for me. He divorced me, and I was treated as a cursed person. I became hopeless. I was crying in deep stress and missed the happiness that she had before she had fistula, and stopped going to church or any other public events. And then when she came to our center and was trained, she said, I'm so lucky to be here with you all. I want to help women in my village to make them safe from fistula. And so she identified 5 women, 2 here, that had lived with fistula. And thankfully, all of these women, all the women that she identified lived with fistula also for 5 years or less. So it's really this participation of our ambassadors and the work that is going out and rescuing these women before, so that they don't have to live, you know, like Buna for 25 years. So just so proud of Tuka and all of our ambassadors, but yeah.
Yeah, I love it. I always love hearing the stories. I mean, obviously, it's never pleasant hearing about what people have gone through, but the happy stories are wonderful, and I'm certainly missing getting out to Ethiopia and meeting those amazing people. So yeah, thank you so much for sharing that, Alison, and it's lovely to see a new face as well. So you know that we can see clearly that we do still have a way to go before fistula is eradicated, and it's not an easy road just to get there. It's still going to take a bit of work. What are the sort of challenges that you find that you encounter along the way to your end goal of eradication?
I mean, definitely, as you know, I mean, Ethiopia is vast. I mean, it's, 100 million people, and, sometimes you fly, from Addis to Mekelle or Hawassa or one of the places where we work, and you just look at the mountainous terrain, and you look at these villages, and you look at how far women have to travel in order to get to a health center, and you think, oh, how are we ever going to get this done? So there are challenges, for sure. And then you think about the women themselves and the challenges that they face. And so I think, for us, I mean, we do we focus on finding those hidden cases. I think that is a real challenge, is because there are areas in Ethiopia that are so remote and so difficult to have access to, that I think, going that last mile. So like in Tigray, for example, where we now have worked in about 30 of the 42 counties in that state, we feel like, yes, we've been able to close our center, but we still are not quite done yet, because there's still those outlying, counties that no NGO has gone to. So it's real easy to work, in areas that are right around the capital. But, when it comes to really going out there, it takes a little bit more effort and grit. So I think finding and identifying those hidden cases, and also we were really blown away. I think awareness still, I mean, even despite, the 10 years we've worked, the progress we've made, we did a baseline just in 2018 in the 3 regions where we work, and found that only 28% of the average population knew about obstetric fistula and the treatment centers. So there's still extremely low awareness rates, and so we feel like we're ramping up that community engagement work, doing events at marketplaces, schools, pregnant women conferences at health centers, but also like going to mass media, like doing radio messaging, and actually one of our ambassadors, Burhan, who you met up in Tigray, was awarded Woman of the Year, and she was on this local TV channel being interviewed. So that's been a challenge that we've been working to address, is just continuing to raise awareness, and then of course in the prevention, I mean, access to emergency obstetric care for the majority of women in Ethiopia is slim. I mean, you just even if you get to a health center, you've been in those health centers. I mean, there's just not there's not surgical care. There's not, there's midwives, but thankfully there's ambulances. So, I mean, the goal is that if a woman can get to a health center and there is further complication, then an ambulance could take her to a hospital where there would be emergency obstetric care. But the health centers are really the main source of medical care for most pregnant women, and without running water, without electricity sometimes, without any maternity waiting rooms where, a woman are told to come to a health center, but if there's no food or coffee, then, or a place for her to sleep, then how is she gonna stay there until she delivers? So those are the things that, are challenges that, working with partners like Ethiopiaid and the government, to really work towards creating health centers that are more inviting and are more safe. And then of course, right now with COVID, it's been a huge challenge because there's not enough access to PPE. And so we've seen that a lot of the progress made in women delivering at health centers is now on the decline because women are afraid to go to a health center. So we're now working with health centers that have had the lowest institutional delivery rates to be able to provide PPE and still do pregnant women conferences to help continue to get women into the health centers. So, and just lastly, I mean, again, with COVID, so what we've done is we've ended up calling, because we give our Safe Motherhood ambassadors mobile phones so that they can call ambulances and they can call health workers if there's an emergency. Well, we've now, during COVID, with our centers closed, we called the ambassadors to check on them. And it was a great opportunity for us to learn, the situation on the ground for these women, for the ambassadors, and hear that there were food shortages, sanitary supplies. I mean, even just soap and basic sanitary support. So now we've been able to mobilize and actually bring our Safe Motherhood ambassadors food, TEF and oil and soap and PPE so that they can also continue to do their ambassador work, but safely.
God, it's certainly far from easy. And look, it's interesting, you talked about the awareness of fistula within Ethiopia, which of course being a big challenge, it's still quite a taboo topic and there's not enough awareness. But I guess in the sense of eradication, and especially the fact that, all of this work costs money, awareness across the countries that can assist, I guess, must be one of the issues as well. International awareness has surely got to play a big role in that. And in countries like Australia, like America, when really it doesn't exist, or any fistula cases are contained and fixed there and then, people don't know. I'd certainly never heard of it. I've never heard of obstetric fistula. It's not something I've come across. So, I mean, your film, obviously, A Walk to Beautiful, the one there, that was a big something done to help raise that awareness. What sort of impact did that have in sharing it on a global community, and how can we keep up that global awareness to keep this fight going?
Yeah, definitely. It is a difficult issue to share but I think that when people do learn about it, then they really become engaged because they know that it is preventable. They know that it's not, it's an issue that we have a solution to. So I think A Walk to Beautiful still, it still has been a great tool to raise awareness, because it just really captured the women's stories. And I think that that's what's so important, is I think to really be able to put ourselves in these women's shoes. And I mean, that's what compelled me to start Healing Hands of Joy, is just thinking, if I had been, I was a C-section baby. So, I might not be alive today if it wasn't for modern maternal health care. So A Walk to Beautiful is absolutely still a great tool. And when we first, produced it, being on PBS and, public, just having those million viewers were helpful in being able to raise awareness. And I think that people can still screen it. So if people are interested to be able to show it, at their home, or being able to wanting to share about the issue of obstetric fistula in Ethiopia, that it is a great tool. And also more recently we did a film called The Ambassador, that was actually narrated by Natalie Imbruglia, and she's amazing. She's one of, like, an ambassador, for for fistula. I mean, it's one of her, passions, is to see it eradicated as well and to help women suffering. So the ambassador really followed the story of a safe motherhood ambassador and her work in the community, and what it was like suffering from fistula. And so that also, I think, is available or will be on your website, or, people could, go to your website for resources, just to be able to see the film and share it, and just getting involved in this cause, is so important, because the more people, I mean, that's why we're so grateful for Ethiopiaid Australia, because we're not alone, here in the US, to have, an entire other countries to really come alongside us and be able to support the women in Ethiopia is so important. So the more people that are involved, more people are raising awareness, ultimately gives voice to the women in Ethiopia that otherwise wouldn't have a chance to share their story. So, I think, yeah, really being able to share it, obviously for us here on, social media networks, and just to help, hopefully, even with something like this, to have a webinar to really have people, to be engaged and to continue to show the progress that is being made in Ethiopia, that, this is really work that, is not an endless cause. We could possibly see the end of this in our lifetime if we can really garner more support.
Yeah, they're such good points, and it's lovely listening to you. I find it such a great reminder of how important it is that we keep talking about this, that we don't let it go, and it is. I don't think many people are in the sort of job where they say, I'd love to not need to do my job, but I genuinely would love to not need to do my job. I would love there to be no need for me to be here, because it would mean we had done exactly that. And eradicated fistula. So we've got everything available on our website. I know you've got another video underway that we'll have to share with people soon as well. So that'll be exciting, and we'll keep sharing that and talking about the work they're doing. And it's great. So you've given us a really good look at the landscape and where we're at, and I know I learn something every time I speak to you. I think I know stuff, and then I listen to you and go, oh yeah, no, I didn't know. Lots of things I still didn't know. Now we've got the floor open to people for any questions, and we have a couple of questions in, and I've actually got one. I would be greedy and ask it first, but I'll go out to an audience question first, and I'll sneak my question in. Now, Alison, earlier on, and I think you touched on a couple of things related. So you talked about the almost 50% institutional delivery rate, which of course is a huge step up. There's still a long way to go, but from where you'd come from the 10%, that is enormous. And you also talked, of course, about COVID at the moment being one of the challenges that you're faced with. So one of our supporters is asking, do you think that COVID, and I guess with the fact that it seems to be a bit slower, the spread across Africa, it could be out there for a lot longer, possibly. Do you think it's going to impact the increase in rates? Do you expect to see rates go downwards? And do you think that you may have to change your program because of the change that COVID could bring?
Yes. Yeah, we're already seeing the impact of COVID, that the progress that's been made, there's definitely been a decline in the rate in institutional delivery since COVID launched, and there was a state of emergency declared in Ethiopia, and it's really impacted a lot of day-to-day life for Ethiopians, and so women are afraid to go to the health center. I mean, even before, it was hard for them to go, but now with this fear of COVID, then they're not going. So we actually, our staff in all three regions have been working with the regional health bureaus to identify those health centers in the counties where we work that have seen the sharpest decrease in institutional delivery rates. And we are working with those health centers to provide PPE. So, I mean, that's, the government is not even really providing, you know, PPE. It's not as widespread. In places like Addis, it's not as much of a problem, but in rural areas, it's, you know, very hard to come by. So to be able to provide that, and then work with the health centers to continue to do community awareness. So before COVID, we would do pregnant women conferences. So with the health center, you know, we would have pregnant women once a month come to the health center to make sure that they were getting their prenatal care checkup, that they had a delivery plan, that there was education about fistula, and one of our Safe Motherhood ambassadors would speak. So we're working with the health centers to be able to do those again in a safe, you know, safe distance and smaller groups. So we've just actually started that this quarter, so that it's really kind of very timely right now, and also yeah, the Safe Motherhood ambassadors. I mean, the fistula hospitals right now are temporarily closed, so we hope that they will reopen in September. That's the plan, but you know, kind of like, you know, here in Australia, you know, elective surgeries, you know, at the time of COVID are just not as available. So what we're doing is actually working to create a registry of cases. So we're continuing to go out and identify cases, but because they don't have a hospital to go to, like, we're taking it upon ourselves to make sure that we follow up with those cases once the hospital reopens. And then we're also doing community awareness at markets, because markets still have to continue in Ethiopia. You know, you can't, that's their source of food, you know, there's no Amazon. So people are going to have to go to the market. So we are having community vans still share about fistula and about the dangers of home delivery. And so those are the things that we're doing to work in the midst of COVID. But great question about the health centers, because that they've absolutely, that have been very hard hit because of COVID and the lack of PPE.
Yeah, yeah. And we have another question, and actually you've answered part of this in what they're doing now, but just asking to describe in a bit more detail the work that the Safe Motherhood ambassadors are doing. And I think probably what would they normally be doing in day-to-day work?
Yeah, absolutely. The curriculum, you know, is about maternal health care, but also covers a lot of issues around nutrition, family planning, you know, the causes of fistula, so how it can be prevented. So we provide our Safe Motherhood ambassadors with that education. And then when they go back to their villages, we give them a toolkit that helps them, like a didactic book that shares the story with pregnant women of a woman that delivered safely and a woman that developed fistula. And then, of course, you know, we're giving her an opportunity to share her own testimony. And then, so the Safe Motherhood ambassadors, they're educating pregnant women. That's their main, you know, role within the community. They work alongside midwives and health extension workers, because health workers, which are few and far between, you know, as you know, Sharon, they're at the health centers. They're not really going into a village. And a health center could be, you know, an hour away from the village. So the Safe Motherhood ambassador is so key in being able to provide that peer education, to really share and also to monitor pregnant women, so that when they do need to go for a prenatal care visit, or when their time is they need to go for delivery, the Safe Motherhood ambassador is really there to help them. And as we've seen with Burhan, you know, Sharon, you've met Burhan, like she is one of our rock star Safe Motherhood ambassadors. I'll just show you a quick picture of her and some of the work that she's done. So this is Burhan with Sharon and Alex. And so Burhan is our Safe Motherhood ambassador from the North. So she was trained, graduated in 2011, in her community, she's now educated over 750 pregnant women. And this is the local health center. So you can see some of the health workers. You're not going to see, like, and again, in a health center, health post, right? There's not like the medical jackets. It's probably, very shocking for some people, but this is what is there. But Burhan has brought over 750 pregnant women to this health post and then to the health center. And because of her efforts, she follows women through till delivery. So this is, one of the young mothers and her newborn baby that Burhan helped assisted. So obviously Burhan's not, she's not a midwife, she's not medically trained. Most of our Safe Motherhood ambassadors are illiterate, but their ability to advocate and identify cases is just amazing, profound, and it really is a huge support to the midwives and healthcare workers that are just overburdened.
Thank you. Sorry. Now we are coming to the end of our time. Now I'm going to sneak in a very quick question, and that brought back some memories. Actually, seeing those photos. That was my very first trip out to Ethiopia, actually, in 2017 when I came with Alex. So yeah, it brings back memories. And on that occasion, I went to the Mekelle Centre, as you said, that's where we were funding at the time, and we have since been funding. In recent years, we've now started funding the Hawassa Centre, since, as you say, the need in Mekelle is not as great as it was. And the last time I was out, I visited the Hawassa Centre. And one of the things that struck me was a lot of, there was definitely a group of women that I met that were younger than the people I'd met at the Mekelle Centre. Now, what I wasn't sure going back was whether this age was to do with the different regions of the country. I know areas of the country that there can be a big difference as to age women are married, etc., or whether it was purely that your work in Hawassa was much newer than your work in Mekelle. So yeah, just interested into whether there might be any reason, or whether it was just purely the groups of women I met on those days.
Yeah, I think the number of factors. Definitely there is a younger demographic in the South, and I think it is a newer treatment center that's now operating full time. And I think that since we've been working there since 2015, we've been doing a lot of awareness, and our Safe Motherhood ambassadors like Duco, have been identifying so many women. So we're able to identify, I think, women that have lived with fistula, not as long. I mean, that, that they've only lived for a year or two, and there is higher rates of early marriage down in the South. So if they're getting married earlier, then they have, a chance of developing fistula at a younger age. Also in Mekelle in the North, I think, we had seen that there were fewer and fewer women that were at the fistula hospital, and that those numbers were really declining. And so sometimes we also trained women that had been had developed fistula, several years back, and then we had engaged them to become Safe Motherhood ambassadors. That wasn't always the case, and others, they might have been there for a second or third surgery. So it might just not have been their first, surgical attempt. And I think that's important just to note that not all women that, go to the fistula hospital are fully cured, that about 25% of women are not fully cured, which also makes, the program and work we're doing so essential to help those women that are not healed. But yeah, I think that, in the South, it's just younger ages of marriage and more cases. So.
Yeah. And so I mentioned that you'd mentioned to me recently that you got a video in production for your I think for your 10 years, celebrating 10 years of Healing Hands of Joy. I think that's close. Can we just maybe let people know what you're going to tell them about in that video?
Yeah, I mean, we just really wanted to be able to celebrate and, before I forget everything, have like, how did this get started? And so it was kind of really nice, just like tonight, like just kind of being able to remember, how Healing Hands of Joy came to be, and just, all the incredible progress that we've been able to make because of partners like you and our Safe Motherhood ambassadors. And so we really wanted to be similar to Walk to Beautiful, the women's stories. I mean, we wanted it to be like really that they are the heroes, of this work. And so that was the goal of the film. We called it, Finding Joy. So really being able for women to really be able to find joy after, so many years of living and suffering with fistula, and knowing that they're not alone in it, and just a lot to celebrate, that there has been a lot of progress made, and a lot of people that have come alongside Healing Hands of Joy to help us and to help the women. So yeah, so we're excited about that. We should have that ready by September, and hopefully we can have a virtual screening party soon.
It's a great idea. That would be an awesome idea. We'll certainly get on to doing something like that. I think that would be amazing. Yeah. Okay, well, I think we've covered all the questions. If I just apologize if we haven't, or if you had a question that you haven't asked yet but want to, of course, do get in touch with us since. So they've been some great questions. Thank you very much for them. And thank you to everybody that's come along and listened today. And I'll put in an upfront thank you to the people. I know we have a few people registered to register because they wanted the recording of this but couldn't come today. So I'll thank them for watching the recording at a later date as well. So we will be sending that link out to everybody that's listened in case you haven't been able to catch the whole lot, or of course, indeed, you want to just have another listen, which would be great. But of course, my real big thank you of the day has to go to Allison. Thank you so much for doing this. It was really, look, it was amazing to talk to you. Again, I hope we get to actually chat in person back in Ethiopia before too long. But look, you're doing some absolutely incredible work, and certainly all of us here at Ethiopiaid, but ourselves as staff, and all our supporters are just so proud to be part of what you're doing. So thank you very much.
Oh gosh, well, thank you, and thank you for this time, and just thank you for all that you've done, for the women in Ethiopia, because we wouldn't have been able to get this far without your partnership, and first in the north, and being able to now move to the south, and just the continued support and joy that you bring to the women too. I have one last photo to show since we have another minute, but this was so meaningful. Before we closed our Tigray Center, we had this class of Safe Motherhood ambassadors in the north that received the koala bear thank yous from your supporters, and and we were able to read the messages, and I'm sure you can imagine this cross-cultural what's a koala bear? But it was just great. So I just really appreciate just how you're reaching and bringing joy to these women, to so many women in Ethiopia.
Wonderful. And yeah, thanks for that. I think, yeah, so it was a koala that year, kangaroos the following year. I'm not sure, we haven't picked our Australian animal for this year, but be prepared for an onslaught of more Aussie critters heading your way.
Great.
Wonderful. Well, I think that's all from us today. Thank you everyone for joining us. Take care, and the majority of us that have got the rest of the day, please enjoy it. And Allison, please put your feet up for what remains of your evening.
Well, thank you again. This has been so fun. Thanks everyone for joining.
Thank you. Take care. Bye.
Take care.